Hello everyone, I'm Dr.Maunica, working as consultant and reproductive medicine at Ferty9 Hospital, LB Nagar branch, Hyderabad. Today we will be discussing the topic blocked fallopian tubes. So primarily the reproductive system in a woman is comprising of a uterus, two fallopian tubes and two ovaries. In a normal situation, every month a lady, she ovulates, as in an egg is released either from the right ovary or the left ovary. That egg is caught by the fallopian tube. The egg enters into the tube and travels midway. Husband and wife, when they participate in a sexual intercourse, the seminal plasma and with the sperms, the sample falls in the vagina. From here, numerous sperms start moving or swimming towards the egg in the fallopian tube. After the sperm reaches the egg, the sperm and egg fuse by a phenomenon called fertilization and result in an embryo. This embryo now travels the remaining part of the tube, enters into the uterus, and the interaction between the embryo and the uterus lining, which is called the endometrium, if it is successful, the embryo ultimately implants and the lady tests positive for a pregnancy. So the tubes, as we have discussed, they play a very pivotal role for a pregnancy to occur. That means an egg and sperm, the fusion is taking place in the tube. So tubes are essential for a natural pregnancy to occur. Unfortunately, few couples, they face infertility issue. That means when they are trying to get pregnant but they fail to achieve this pregnancy, the reason could be blocked fallopian tubes. These blocked fallopian tubes, what could be the reasons for a blockage of tubes? There can be numerous reasons, but I will talk about the most common ones today. First and foremost, it is the infections. Infections like sexually transmitted infections. Now these infections, what they do is, they start entering from the bottom tract, that is from the vagina, they gain entry into the uterus. Now these infections, the organisms, they travel to the tube and they go destroy the lining of the tube. The lining of the tube consists of epithelium with small cilia like hair-like structures. Once that lining is injured because of the infection, in the process of healing, there can be fibrosis, there can be scarring, and that will result in a blocked fallopian tube. In the presence of a blocked fallopian tube, there is no possibility of an egg and sperm meeting with each other, and hence they fail to achieve a pregnancy. Now this is first reason, that is blocked fallopian tubes due to infections. Now second, it can be some kind of surgeries. So when we say surgeries, the lady at a younger age, she might have underwent appendicectomy or any surgeries in her pelvic area or pelvic region. Now after this surgery, post-surgery, in the process of healing, there can be adhesions. Adhesions means there can be different structures which are sticking to each other. And in this situation, at times the tube is also involved in these adhesions. The tube gets kinked. The tube, instead of staying in a normal caliber, it gets kinked, and that also presents as a blocked fallopian tube. Now third reason can be endometriosis. In endometriosis condition, what happens is the lining inside the uterus, which is the endometrium, during menstrual cycle, or it can be at other times, it travels backwards in a retrograde fashion into the tubes, and also it comes out via the fimbrial opening ends of the tubes and comes and deposits on the ovary and all the adjacent organs like intestines and over the peritoneum. And every month how the lady bleeds from her uterus, the process of formation and shedding, the same situation is happening in this external endometrial deposits as well. Over time, it builds up as inflammation and scarring, and even because of the endometriosis, it mimics something like a post-surgery condition, and you find adhesions. That will also cause a blocked fallopian tube. So when we have blocked fallopian tube, it can be unilateral, as in only you have one side tubal block, or it can be bilateral, where both the tubes are blocked. As long as both the tubes are blocked, bilateral, it becomes impossible to achieve a natural pregnancy. You have to go for other ART, that is assisted reproductive techniques like an in vitro fertilization to gain a pregnancy. But in the presence of a unilateral fallopian tube, that is you have only one blocked fallopian tube, the other fallopian tube is still patent, then you still have a shot at achieving a natural pregnancy or pregnancy through smaller techniques in ART like ovulation induction or an IUI, that is intrauterine insemination cycle. How to test if you have a blocked fallopian tubes? There are numerous tests. One is HSG, which is very commonly seen, that is hysterosalpingography. You get an X-ray report where you can see if it is blocked or open. We have other methods also like sonosalpingography, and then we have a HICO-C, which is now fast emerging. So like this, you have multiple techniques through which you can figure out if your tubes are patent or they are blocked. So you get the test done, you know the status of the tubes, and accordingly the clinician will advise a suitable procedure for you. Thank you.